Hello, I am Dr. Kevin Thomas, a cardiac electrophysiologist with the Norton Heart and Vascular Institute. A pacemaker is a small electronic device used to treat patients whose hearts are beating too slowly. The pacemaker has two main functions. It keeps track of the heart's natural electrical activity. This is called sensing. It also sends small electrical impulses to the heart to make the heart beat. This is called pacing. The pacemaker monitors your heartbeat 24 hours per day. If the pacemaker senses that the heart is beating too slowly or pausing too long, it sends an electrical pulse to stimulate the heart to contract and pump blood. This electrical pulse is very small and cannot be felt by the patient. A pacemaker is composed of a generator, which is the small, lightweight metal case that contains the battery and circuitry, and leads, which are insulated, flexible wires that are placed in the heart and attached to the generator. A pacemaker may have 1, 2, or 3 leads, depending on each patient's specific condition. The pacemaker implantation procedure takes between 1 to 2 hours and is performed in the electrophysiology laboratory of the hospital, where you will be placed on an X-ray table. You may be given medications intravenously to sedate you or make you sleepy. These medications help reduce your anxiety and relieve your discomfort. Your chest area will be cleaned with antiseptic and sterile drapes will be placed to cover your body. A local anesthetic will be administered with a tiny needle to numb the area where the incision will be made. You will feel a pinprick and possibly a stinging sensation for a few seconds. A small incision, approximately 2 to 3 inches long, will then be made in the upper chest area just below your collarbone, and a small pouch or pocket will be created under the skin where the generator will be placed. The lead or leads will then be inserted into a vein in the upper chest and advance to the heart under X-ray guidance. Once the lead or leads are in the proper position within the heart, they will be tested to make sure they sense the heart signals correctly. They will then be connected to the generator, and the pacemaker system will be placed in the pocket. The incision will then be closed and covered with a dressing. Following the procedure, you will be moved to a recovery area to rest quietly for several hours. Your heartbeat and blood pressure will be monitored continuously to check for complications. Often, patients are able to go home the same day, but your physician may elect to keep you overnight for monitoring and pain control. Upon discharge, you will get information about how to care for yourself after the procedure, including medication changes, wound care, activity guidelines, device care and maintenance, and a follow-up schedule. Be sure to review pre- and post documents on what to do before and after the procedure. As always, if you have questions, please reach out to your doctor's office. Thank you for choosing Norton Heart and Vascular Institute.